million in state funding has recently been released for Rogers Behavioral Health to build a new hospital in Chippewa Falls. Now we're hearing from the company about the plans to provide mental health care access in the Chippewa Valley. Toby Moore has the latest.
The Chippewa Valley has been incredibly inviting.
A final green light on plans for Oconomowoc-based Rogers Behavioral Health to build a mental health care hospital in Chippewa Falls. The $10 million passed on a bipartisan bill authored by local Republicans Jesse James and Clint Moses has been released, and the Department of Health Services have signed off on the plans. Once built, Rogers Chief Clinical Officer Heather Jones says the hospital will offer inpatient, outpatient, and residential mental health care for adult and adolescent patients, as well as medical detox.
Individuals that need help with depression, anxiety, trauma, mental health and substance use, we are, able to do all of those things.
Here at the site of the new hospital off 178 and Wissota Green Boulevard, Rogers plans to have a shovel in the ground within the next 60 days. The goal is to have construction complete by the spring of 2027. In the meantime, Rogers will be opening 2 mental health clinics, one in Eau Claire near Sacred Heart and one in Chippewa Falls above Whirlybird Coffee, aiming to open by September. They are also looking at ways to partner with area schools for mental health education. CEO Sydney Meyer says they want to work with the community to help fill the gap left by the HSHS hospital closures.
We want to know what you need. We are not going to be intrusive and tell you what you need. You tell us, where do we need to be present? What is going to help you? How can we work together? Because it doesn't work in a community if you're not embedded in that community.
In Chippewa Falls, I'm Toby Moore.
Thanks, Toby. Rogers estimates the hospital will create about 100 new jobs.